your actual health complaints are not being listened to, you're not actually getting help, like why bother? Why even bother going to the doctor, right? So that is an incredibly common experience. Hit me, producer Potts.
Dr. Sarah, you have lost at least 100 pounds 3 times now. So I know this is personal to you. And we have been talking about the harmful impacts of making assumptions about health via a number on the scale. Why is it so important that we don't judge others or ourselves based on our weight?
Because weight discrimination is overtly harmful and may actually completely explain the slight increase in health risks in overweight and obese people after you account for things like physical activity. So when we talked about the science showing that you can be healthy at any size, one of the studies that I quoted was a study where they looked at the risk of all-cause mortality in men who were fit versus unfit, and showed that the risks in the overweight and obese category almost completely disappeared once you looked at fitness. Like once you took that into account, that there was only a 10% increased risk of all-cause mortality in the fit overweight and fit obese men compared to fit normal weight men. But that being unfit at any size more than doubled risk of all-cause mortality over a 10-year follow-up period. So what is the explanation for that 10%? It is potentially the psychosocial stress of experiencing weight discrimination, of being on the other side of even good meaning, like weight discrimination isn't always just negative. As somebody who has been obese for a large fraction of my life, I remember in my late teens discovering that I quite liked running. And the best time for me to go out for a run was first thing in the morning. And I remember this one time, some kid, some teenage boy on a bike rode past and shouted at me, "You're going to have to run a lot faster than that to burn all that blubber off." Right? So like weight discrimination can be very overt and very negative and very mean. I quit running, by the way, as a result of that. So it can be really mean. It can be bullying, right? It can be horrible. And it can also be the well-intentioned, like you've just had a stomach bug and you've lost 10 pounds and you have someone go, "Oh my gosh, you look fabulous. Have you lost weight?" Right? Like that well-intentioned positive statement still says you have higher value in a smaller body than you do in a
Right.
bigger body. So it's like it's the bullying, it's the microaggressions, and it's the passive aggressive, like sweet but like still cutting remarks, and they all add up to a stress response. So studies have measured this in different ways. So they're sort of like survey studies where they kind of ask people about their experiences with weight discrimination. They also measured on the other side where they show people, like the same video but with two different size people, and like measure how they react to that video, right? So there's different ways of measuring weight discrimination, but studies show that experiencing weight discrimination increases health risks. So it increases the chances of having insulin resistance. It increases the likelihood of having higher risk factors for cardiovascular disease. And different studies like hone in on different things, but it also doesn't matter how you measure body size. So if you look at BMI, or if you look at hip to waist ratio, if you like just look at weight specifically, like different ways of measuring what size category you fit into, and different like measurements of how that's impacting your health, show that the experience of weight discrimination just by itself, regardless of your size, once we control for your size, because people experience weight discrimination even in a normal like weight range, um, which is also so frustrating and ridiculous. But that by itself increases health risks. This is data from a 2017 study, just to put the magnitude of effect into perspective. So they looked at the link between cardiovascular disease and perceived weight, gender, and racial discrimination in America. The participants who experienced weight discrimination had a 2.56 times higher likelihood of a heart attack, a myocardial infarction, and a 1.48 times higher likelihood of minor heart conditions after accounting for BMI, smoking, alcohol consumption, major depressive disorder, stressful life events, age, sex, income, education, and race and ethnicity.
Wow, that's shocking. And we know how harmful stress is to our body. We know when we're stressed that we won't absorb nutrients properly, right? It can affect our gut microbiome health. It can affect our sleep. It can affect our hunger signals. You've talked about that before. We know how harmful stress is. And so that just logically makes sense that that could account for that versus the weight itself, because we just talked about in the previous video how the healthy habits themselves are protective, not the number weight lost on the scale. So then that just crystallized that so much more. Wow, that's shocking.
And studies show it is the stress response, right? That is the mechanism behind it. So they've done studies, for example, where they take women who have different perceptions of their own size, and then have them do, a presentation. And some of them are told, this is video and people are going to see you. And some of them are told this is audio only. And then they kind of divide them into, what they think of their physical appearance, and then measure, using like surveys, like their experiences of weight discrimination, and basically show that even when you're controlling for a person's perception of what they look like, the experience of weight discrimination increases the stress response in the like video public speaking format and not the audio public speaking format, right? So like the anticipation of being judged for how you look because you've experienced weight discrimination magnifies the stress response. But the other piece here that is contributing to worse health outcomes is medical discrimination. So there are studies that show that people in bigger bodies get worse healthcare. So actually two things. They get worse healthcare because, oh boy, have I experienced this. When I started getting recurring migraines in my late teens and early 20s and went to the doctor, the first few different appointments, I was told, well, you just need to lose weight. Weight is not I don't think it's a risk factor for migraines. I continue to sometimes occasionally have migraines, even though I'm half the size. Like it is a different phenomenon. It's actually, migraines are really fascinating biology, and they also are a terrible experience. But instead of getting help for my migraines, right? Instead of getting a prescription for one of the very, many options there are now to help with migraines, I just got dismissed. I experienced so many similar things, going to the doctor for one thing and being told, oh, well, you just need to lose weight, that I stopped going to the doctor unless I was ridiculously sick. And that is a really common experience. When you've just had so many times where you feel like you're not being listened to, you're just being judged based on your outward appearance, your actual health complaints are not being listened to, you're not actually getting help. Like, why bother? Why even bother going to the doctor, right? So that is an incredibly common experience. So studies show that people who are overweight and obese delay going to the doctor. They don't get as many like annual physical exams, right? Like your annual exam, which the whole point of that is to identify, right, early stages of something that an early intervention has like great success, right? So like, hey, your blood sugars are a little bit high. We can make these easy little changes and, you know, avoid developing type 2 diabetes. Or hey, your blood pressure is a little bit high. Let's, you know, make these easy little changes to bring it back down so we don't have increased risk for cardiovascular disease. Let's, you know, right, let's look at your I mean, if you're lucky to have a doctor who measures vitamin D, right? Right, let's look at these risk factors. And people who are overweight or obese skip those appointments at a higher frequency, even when they have good healthcare coverage, because, like, I don't know, you just feel like you're going to go in and get a lecture. And you're like, I know. I'm confronted with this in every aspect of society. Every single encounter is telling me that society would view me with more value if I was in a smaller body. But I want to understand these other things. Like I'm making, you know, these changes and that are going to improve my health. And those are not being recognized. We're not talking about, you know, how active you are. We're just talking about, this number, I don't like it. It should be a different number, right? It's so surface.
And there's the flip side too. If I've heard this said before, which is awful, is that people will say, "Oh, I got a new doctor and they're overweight, so I'm not going to listen to their advice."
Yes,
like you
also
hear
true.
that, or like, "Oh, I would never hire a personal trainer who's not like it." It's just things like that too. It's like that has nothing to do with that person's experience, education level, knowledge, and overall health.
Right. Yes. No. And like absolutely, medical professionals can also experience weight discrimination, and there's a piece of this that's internalized too, right? I mean, not it's more than a piece. It's a giant asteroid-sized chunk that gets internalized, where you know, we believe it of ourselves, right? Like we see ourselves as having higher value if we're successful in a diet and lose some weight, right? And we see ourselves as having lower value when, because diets all set us up to fail, when we inevitably, you know, end up back on the yo-yo. And we probably should do a whole video just on the harms of yo-yo dieting. But the other like part of this is that because overweight and obese people avoid the doctor because of weight discrimination, but also the assumptions made by the doctor. I mean, there are a variety of studies showing that worsens medical care. So like a doctor is more likely to miss a life-threatening diagnosis because they assumed your symptoms were related to your weight and not related to some other kind of underlying cause. And I have a study somewhere that has statistics on that. I could pull that up. So this was from a 2006 study that looked at 300 different autopsy reports, and it found a 1.65 increased likelihood of obese patients relative to normal weight patients having a significant undiagnosed medical condition, misdiagnosis, or inadequate healthcare that may have contributed to their death. So the examples they gave was lung carcinoma, lung cancer, endocarditis, and ischemic bowel. So they were 65% more likely to have some big thing that contributed to their death than the normal weight patients. Like that is a huge, huge effect. Now that's just one relatively small study, and it's from 2006. Like hopefully things have improved in the last 20, or not quite 18 years, I guess. But it is still an illustration of the harm of weight stigma and weight discrimination that is contributing to poorer health outcomes that has nothing to do with any risks associated with actually just being in a bigger body.
Wow. I really appreciate you walking through all of this. And then also, of course, as you always do, giving us scientific studies and statistics to like show. And it just like really I hope that everyone comes away with this from this video with like either feeling heard and seen and like, yeah, you relate to that, or like have a new appreciation or understanding or look at things differently around this topic. And it just, like you said, it's so important that we don't make assumptions about someone via their physical appearance, whatever that may be, right? And I think that goes deep, but also the fact that it is linked to actual negative health outcomes itself is just, it's heavy. It's a lot.
Yeah. So I've lost 100 or more pounds 3 times. Once in my 20s, once in my 30s, and once in my 40s. And the first time I was 23, I guess. Something like that, 22. And I remember very clearly this like shift where I had lost enough weight that strangers made eye contact with me. So like, I'm a chatty, friendly person. I talk to strangers I strike up conversation with anybody who's in my vicinity. And there was this moment where I would be, in line at the grocery store, or somebody would suddenly people started holding doors open for me, right? Like going into the bank. It was the olden days when you actually went into the bank for stuff. And someone would hold open the door. And I would say, "Oh, thank you." And they would say, "No problem. Have a great day." Those interactions were completely novel to me. I had not had them before because I became obese pretty early in my teens. And that experience of going from not being seen to having people be uncomfortable, making eye contact with me, to feeling seen and feeling like I was interacting with society. I bring this up just because I think my call to action here is to really think about the assumptions you make, right? How often have we seen somebody in a bigger body on social media get just so much criticism if they eat a slice of pizza in a video, right? Whereas somebody in a smaller body eats a slice of pizza in a video and they don't get that same bombardment of rude comments. So just think about our own biases and assumptions and what the actions are, whether we are the bully or the well-intentioned, but the compliments that are still body checking, or the person who's just uncomfortable and not making eye contact, right? Those are all things to kind of reflect on. And if I can encourage one thing, it's eye contact. Yes,
being kind to ourselves, because as much as we're judging other people, which, it's hard not to judge other people. Sure. It's ingrained, but also all of that, realizing that will help you talk to yourself in a more kind way, because you wouldn't want to talk to a friend that way. So I think it helps both
100%. Yeah.
Yeah.
So I think awareness is one of the first things you can do. There's quizzes you can do online to see what your implicit biases are. And there are ones focused on body size. Just first of all, understand what are implicit bias is normal. Right. That happens, right? We move through society and society teaches us all kinds of subliminal things.
Right.
But being aware of them then helps you change your behavior. And if I can encourage one thing, it's make eye contact with people and strike up a friendly conversation. That.
If that's something you like to do, you may be an introvert and you may avoid all people.
Okay.
I'm
more
I see what you're saying, though.
I'm more
yeah.
If you are the type of person who talks to strangers, Talk to all
Right.
strangers.
Talk to all strangers.
Yeah.
Exactly. No, I understand what you're saying. I was totally throwing that in there because I'm such an introvert, but yeah.
Fair. Okay, fair.
Okay, cool. Well, this was heavy
Yeah.
and a lot to take in, but I really appreciate you being open and willing to talk about this stuff. I know that, it can't be easy to open up and talk about this stuff publicly, but I'm really appreciative, and I'm sure the people who are watching this video are appreciative of you doing that and covering this important topic. And it's something we've been asked about quite a lot. So I really appreciate you covering that. For those of us who are looking for information or support, you mentioned there's a test you can go take. That would be interesting. Maybe we can find that and put that in the show notes for people. And then also maybe we'll grab those studies and put them in the show notes, because I feel like having that might be really helpful. But thank you so much for sharing this with us. I really appreciate that.
Thank you.